Hello and welcome back to Mirror Interpretation Todorova. Welcome back to my YouTube channel. And hi, Tima. This is for members only. I'm creating this video. I'm gonna try to answer your questions in two videos because this comment that you read, um, I think it's worth to do two videos, and I'm gonna separate and try to speak a little bit less, but focus on one topic at a time. Hi team, I'm gonna read the first portion of the question first. Hi Joanna, I did not see the notification of the video, the previous video I created talking about money. Thank you for making it and clearing this up. If you don't mind, is there a possibility you can make a video on how to deal when the patient is a minor but has non-English speaking parent in the room? Because usually doctors and patients speak non-stop. Do you summarize to the ma'am after a couple of sentences or right after the doctor spoke? I interpret even if it's also what the parent says. In this case, I would only be interpreting into Spanish for the mother, considering the provider and the patient speak English. Those scenarios can be uncomfortable, I am sure. Thank you for always being kind and understanding. I know I'm really good at my job. You are really good. Bravo to yourself. Don't forget to compliment yourself every day. But I constantly want to improve and develop better ways to come across certain scenarios. Thank you so much, Tima. And here I'm going to address this question because this scenario of having one parent in the room that does not speak English, like the mom or one of the parents, this often also a lot of in school calls where the child speak English but the mother doesn't, and you interpreter are added in this situation to interpret. Okay, so set up the expectations of the call in the beginning. If we're gonna talk about best practices and best protocols, your statement is, I'm gonna give you example, there is different ways to introduce yourself. In some cases, you do not read the entire statement that I'm just gonna state for you, but hello, I will give you example, Tima. Hello, my name is Tima, and I'm going to be your Spanish English interpreter. I will interpret everything you say and keep it confidential. This is the pre-statement or introduction of the interpreter. Usually in the beginning of the call, I use your name, Tima, in this case, but it could be any other name. My name is Giorgio. By best practices and best protocols, because if you go and watch my videos, best practice, best protocols for the interpreters and code of ethics, by the standards, from the moment that you introduce yourself, this is the moment that you're gonna interpret everything you hear, vice versa, correct? Unless you're paid to interpret or requested to interpret only versus one language, or unless you're requested to just monitor, following the best practices and best protocols, it means that you have to interpret everything you hear. So let's say that we do not know this situation, that there is one person that speak English, one person speak Spanish, one person understand, one person doesn't. In most of the cases, the providers, the doctors, the school directors, they do let me know, me the interpreter, at some point in the beginning that we have a minor and we have a parent. So usually in the beginning of the call, you know that there is a child and that there is an adult there. The doctors not usually let you know, and the reason why they let you know is because the minors, although they can speak English, they are legally incapable of taking decisions about their own health. The person who is taking the decision is the parent. So why I'm saying this is because it's very important that the parent understands what the doctor say. said that if I personally, okay, let me proceed further. If I personally know that there is several people in the room, me, out of introducing myself, which is the first step to set the expectation how the call will go, the moment that I'm instructed, this is step number 2 to set expectations. The moment that I'm introduced to the rooms, for example, sometimes I do workers' comp and we have 6 people on the line, on the phone. It doesn't matter if they're in the phone or if you're physically in front of you. I instruct them and I will tell you I will exactly tell you what I'm saying. This is the interpreter speaking in order to assure, or also if it's for the protocol, for the recording, in order to assure that we can hear each other clearly, and I provide quality interpretation for you. Please do speak one person at a time and pause for the interpreter to interpret. Even if you understand, please avoid speaking with the interpreter. I set the expectations here. The moment that I know that there is more than 2 people in the room, in this case, also, if you're not so sure if you want to interpret everything or not, you could say, hello, this is the interpreter speaking. Doctor, would you like me to interpret everything for the parent while you talk with the child, or would you like me not to? But independently what the doctor says, if the doctor says monitor, your job is to interpret everything that is said. So most of the times you have to interpret everything. And how you avoid to be in this situation where you said, Shell, do you summarize for the mom? No, you cannot. You should not. And in this case, if you forgot to give the instructions in the beginning when you find out that there is more people taking part of this call, because sometimes in my calls I have 3 people that speak English and 2 people that don't. So are you gonna exclude them? Let's say it's a legal portion. You cannot exclude them because your job is to interpret. So if it's medical, you cannot summarize, and usually you cannot do simultaneous. I sometimes do simultaneous in medical, but it's usually when it's a different type of, let's say, a statement. They put a recorded statement in English instead of in Russian. I would do it simultaneously the moment that I realize that this is happening. But simultaneous is not a mode to interpret in medical. And number 2, summarization is not a mode to do in medical because medical is related to human life. And the main role and responsibility as we have as an interpreter in medical is to convey the meaning of a message and make sure that whoever, in this case parent, is taking a decision, understand the dynamic. Because when there is minor, even if it minor is 17 years old person who speak perfectly English, the decision maker is the parent. And the reason that the doctor informs you about these dynamics is because here in the beginning of the call, you have to set how the call will go. In the standards, it's called setting the expectations for a call. And the pre-statement by law, it says interpret everything is said and keep it confidential, which means that you have to interpret back versus Spanish for the ma'am, everything the doctor and the son, if it's a son or a child, have as a conversation. Yes, in this case would mean that the interpreter will have to only interpret versus Spanish. I will give you a similar situation I had where we have lawyer that speaks Russian and English, and he is officially representing a defendant in court. And so the lawyer, as official representative of the person X, speaks English as well, and he addressed directly the judge. In this case, the the defendant or the person is physically, or plaintiff is physically present, but the lawyer responds all the questions and the conversation is just in English, versus a lawyer and a court representative and judge. They too speak English. And then you have a third person here who speaks Russian. You are in the line to interpret only versus Russian. This is a kind of complicated dynamics because unfortunately legally um, they are not like laws for that, but when they call you and add you to the call, they do let you know. I have similar situation with children at school where me as an interpreter, I'm added and I have the parent who does not speak English and the child obviously who speaks English. And there would be several portion of this conversation: portion director child, which is in English; portion director parent, which is gonna be uh, not in English. Obviously you have to interpret everything, what the director tell the child, and then what the child responds, and then what the director wanna advise the parent. It's complicated. I know it's complicated, but this is a great question, Tima. So, the mode for medical interpreting it's consecutive. Consecutive mean one phrase English, one phrase Spanish. For example, the doctor say, "Hi, my little friend, how are you being feeling? I feel like you have headache," for example. "Hola, mi amigo, ¿cómo estás? Yo sentí que tú tienes mal de cabeza." I speak a little bit Spanish, Tima, you know. You say this to the mom. Mom is there. Mom knows that the child has a headache. But you cannot let the doctor and the child have a conversation for 20 minutes and then be like, "Okay, now I prescribe you antibiotics." Who is going to say to the mother why the antibiotics are? "Oh, now we're gonna have surgery. We're gonna bring you to the emergency and do surgery." You stay quiet for 20 minutes and then you say to the mother, "Oh, we're gonna go and have surgery." You cannot do this because you break the protocol. How you break it, you have to interpret everything it says, and two consecutive. Consecutive mean pause for the interpreter, pause for the interpreter. No, summarization is not good for medical. Do not do this. The only case in which I do summarization is business meetings. And a lot of the times is when they show some videos with some sound and some explaining some things. I do summarize some of the videos presenting certain products or quality of certain materials. This is when I use summarization, but usually this is not professional. This is not the case to do this. So unless the doctor tells you, "I want you to be waiting, monitoring the call, and on the end summarize," you can do this. But out of any specific instructions, you cannot just decide to summarize because you feeling uncomfortable. I know it's very challenging. I had one time 12 people to interpret for in a trade fair where they were purchasing some products. It was a governmental organization. And you cannot imagine 12 deputies walking by and stopping and having different questions. This was extremely challenging for me. So how to handle this, it's to remind the boundaries. Interpreter speaking, one person at a time please, and pause. One question at a time and pause. Interpreter reminding, please pause for the interpreter. Please hold on. I just say pause, or if I'm physical, I make these gestures and they all know that they stop. But usually most of them are mindful when I'm physically there, so I don't have to do this quite a lot when I was doing business to business quite every day. But this is the moment that you realize that you have to do versus Spanish, I normally would do this. If it's physically present, I will locate myself very close to the chair where is the parent or behind her, because how to position yourself is also very important. If I am the doctor and we have two patients here, the interpreter have to be behind those two patients. And if the person that doesn't speak English is the mom, I will position myself behind the mom, and that would be a little bit faster physically when we are present. How are you feeling? You have pain, tienes dolor. I would just do it a little bit faster for the mom, semi-simultaneous if you want to. If it's short questions, tienes mal de cabeza, sí un poquito, sí tengo mal de panza, es come comiste, que comiste qualcosa, tienes alergias. You can do this real fast. No, non como, non tengo alergias, pero tengo mal de panza. It's usually you can do quite fast those, but you have to be closer to the person that does not speak English. Number one rule, or number two, make sure that you set the expectations for the doctor and the son. Make sure to remind them, use short phrases to assure accuracy in interpretation. And in the beginning, usually when the conversation is between the doctor and a child or doctor and patient, uh, you should interpret that. I do it for the book. I interpret it directly, although sometimes the doctor say, interpreter, you do not have to interpret this, and I just pause, for example. But versus the Spanish, yes. And usually the doctor would say, interpreter, this is for you now, this question is for the parent. You understand that when it's the question is for the parent, you have to do back and forth. And when it's just doctor child speaking and they speak English, you do only versus the parent in the Spanish language. Best way to avoid having to summarize and feeling uncomfortable is in the beginning. I usually ask the doctor, do I have to interpret can I interpret only versus Spanish for the parent? Is that okay? And sometimes the doctor says, no interpreter, let me do the assessment with the child, and after that we're gonna talk with the parent. Sometimes the doctor doesn't want you to speak while he assessed, because he not only asks questions, they listen the child, they listen the heart, they do different tests, and sometimes you are talking, it's not welcome in the time of this exam and little chat doctor-patient. But most of the time, in the beginning of the call, Tima, the moment that you realize that there is a minor and a parent, you introduce, I will interpret everything, and then you said, doctor, this is the interpreter speaking. I am going to interpret for versus Spanish for the parent. And once you have to have a question for the parent and want me to go back and forth, do let me know. And this day, doctors know, they're used to this, in order to avoid repeating the same information for the parent only after the assessment is done with the child. This is uh, how I handle this, and I think this has been giving me pretty good result. The moment that you realize that there is more than two people, if they want you to interpret versus Russian portion of the call, it's they're gonna be back and forth. In a lot of conferences I work, sometimes I only did versus one language, and there was a second interpreter. For example, I did versus Russian, and there was a second interpreter that will do Russian English only. So if it's more than two people, if it's like a conference, if it's a group of people, that's my advice. I hope it was useful. Please do share, like, and subscribe. And thank you so much for being my member. I hope this helped you, although I am trying to separate your comments in few questions, in few videos. I hope this answer you how, in my opinion, to handle this with respect, with dignity, according to best practice, best protocols, following consecutive mode, following interpreting everything you say and keep it confidential, and also respecting the doctor's needs in this moment, because the main rule is the well-being of the patient, in this case is the child. And if the doctor asks you to hold the interpretation, you can do so. You can ask in the beginning how to handle this, just in the beginning of the call. Do not wait for the call to get this side people, 10 people talking, and you trying to grasp what is going on. Set the expectations since the beginning. This is really gonna help you to avoid unpleasant situation. I hope this was useful. Thank you for being here, Tima, and thank you for guys being my members. Have a great day. Bye bye.